Hi everyone. Today is Wednesday, December 23rd. We're getting close to the big day of Christmas. As promised, I've got a video for you today mostly about vaccines. I'm also going to answer any extra questions that I have. I'll tell you first of all that right now in Hanna and special areas, we have 7 active cases of COVID disease. So things are fairly stable for us right now. Nothing new exciting happening as far as the hospital's going or the medical clinic. If you've gone online, you've seen that we are closed on Monday the 28th in lieu of the 26th holiday, but otherwise we are open and doing all of our regular work both here and at the hospital. As you know, the hospital's open 24/7 even on Christmas. It's hard for me to believe that some people think that we close on Christmas, but we definitely don't. We have physicians and nurses staffing our hospital for sure over Christmas. So most of you who have been watching the news have learned that we have a vaccine for COVID-19 disease, which has been approved by Health Canada. That is the one from the Pfizer company. This particular vaccine is given in 2 doses in order to create full protection. The first dose on day 0, the second dose is given on day 21, so 3 weeks later. This injection is given intramuscular, so it's going to be an injection inside of the muscle of our upper arm. In order to understand how the vaccine works, it's kind of important to understand how infection works. So what we know right now is that the SARS-CoV-2 virus, which causes COVID-19 disease, comes into our bodies through our nose, through our mouth when we get droplet spread. It's going to enter into our body cells through a spike protein that exists on the outside of the cell. So I think of a giant ball that's got little spikes on the outside, a little bit like those Christmas oranges you used to put cloves into on the outside. And it uses those cloves or spikes to gain entrance into our cells, and then it turns our cells into virus-producing factories. So it pumps out a whole bunch of these SARS-CoV-2 viruses, and they spread throughout our body and they wreak havoc. They cause the bad lung issues. They can cause diarrhea and headaches and runny noses. So what we need to do is we need to bump up our natural immune system by having some speed factor in there. We want to be able to fight off this virus before it gets into our cells, replicates itself, and travels everywhere. So that's how we use vaccines. The traditional vaccines that most of you are more familiar with, things like our childhood vaccinations, mainly rely on using either dead virus particles or killed virus particles or some piece of a virus. They give that to our body and we create an immune response to it and create storage cells. What the new one out there is an mRNA vaccine, standing for messenger RNA. How this originally developed for the COVID-2 virus is that back in China, when we first saw this, scientists were able to create the entire genome sequence for the virus. Basically, they have the entire instructions from start to finish on how the virus is made. We were able to figure out exactly what part of that instruction makes the spike proteins on the outside of that virus. So we'll go back to our orange. We know how to make the cloves that stick on the outside of our orange. We know how to build the instructions to make those. What we did now with the scientists, with the Pfizer company, is they were able to take just the piece of instructions that make the spike protein and put it into a clump of fat, and we inject that fat into our bodies, into our muscles right here. Our cells are going to take that vaccine with those instructions and bring it into the cell. And then they use our body's natural protein producing factories to make a whole bunch of these spike proteins. These spike proteins are not natural in our bodies, and so the way our immune system reacts is saying, oh no, there's something here that's foreign, I need to attack it. So we now are going to create antibodies or infection soldiers that are going to kill those spike proteins. What happens then is we keep all those instructions, all those soldiers in our body in a rapid access system, so that if the SARS-CoV-2 virus comes into my body, I already have the instructions and know how to kill the spike proteins and therefore prevent the virus from actually infecting me. This is a really neat system. And we know that this virus is the vaccination is 95% effective at preventing symptomatic infection. So I've heard this question a few times. Why do I have to keep wearing my mask after I get the vaccination? That's because the studies are still ongoing to find out whether or not the vaccine prevents asymptomatic infection. So whether or not it prevents you from building up any potential to infect other people. It likely does, but we don't have the data enough yet to tell you that it does. We know it prevents serious infection really well and symptomatic infection really well too. So that's what we're aiming for right now. If we don't have badly symptomatic people, we know they're going to have less spread, and we know they're going to have less use of our healthcare system. So that's really, really important for us. I'm going to go through a few questions that I've received to try to help clarify some of the issues. The first question I got was, should I be afraid because this came onto the market really, really fast? That makes me nervous. Maybe they haven't studied it enough. So there's a few reasons why this vaccine was able to come to market so quickly. It's been just about a year since we knew about this virus at all. The first one is that it was fast-tracked. So basically you get a giant pile of all of the approval forms that need to happen. And because of the severity of the coronavirus pandemic, this one was moved to the top of the pile every time. So I feel kind of bad for the people who were already on the top of the pile that got put down. But everybody around the world said it's really important for us to get this done. So let's put it on the top of the pile for people to read through and sign off on when they need it. The other reason that this came to market really fast was because of the way the vaccine was produced. Normally, you'd have to grow vaccine in something like a chicken egg. You'd have to wait for it to be able to reproduce itself, and that takes time. An mRNA vaccine is made in a lab. You can do large amounts of it very quickly without as much time to wait for natural growth to occur. That meant we were able to produce enough for the study and enough to be brought to market much faster. The other way that this came to market faster is just because of how many cases of coronavirus 19 are out there. If you compare it to something like the shingles vaccination, you split people into two groups, you give half of them a vaccine and half of them a placebo, which is sort of a pretend vaccine of things like salt water. Nobody knows what kind they got. We need to wait for enough people to develop an infection on their own to know whether or not a vaccine has been effective. And it takes sometimes 2 or 3 years for enough people to have shingles for us to say that more people in the placebo group got shingles than people in the vaccination group. But coronavirus is so common right now and so quick at infecting people that it really didn't take very long for them to get enough people in the placebo coronavirus vaccine group that got sick versus the vaccine group for coronavirus. So the fact that we needed the vaccine quickly actually helped us make it quickly. We were able to show that it worked really fast because of how fast those infections come on. So some good reasons why it came to market quickly and makes me feel pretty good about it. Some other questions that I got. So the first one says, my husband is allergic to erythromycin. We have heard that one of the vaccines may have erythromycin in it. Is this true? No. Right now, the ones available in market in Canada, which is the Pfizer vaccine, does not contain erythromycin. In the post-vaccine study groups where we're looking at reactions that people have had, in the study group of over 40,000 people, the only reactions that they had were what we call a local viral syndrome. You might have a sore arm, you might have a low-grade fever, and you're going to feel kind of tired and achy for a few days. That was it. When it came onto market and started being given to the general public, we've had a few people who have had severe allergic reactions. These are called anaphylactic reactions. All of these people were successfully treated the way we would treat any anaphylactic reaction. They came to the hospital, they received epinephrine treatment, things like Benadryl at the same time, and they recovered from that. So what we've told people is that if you are someone who carries an EpiPen normally because you're prone to allergies or you have a known anaphylactic reaction, they'll likely watch you after your vaccine for about 30 minutes instead of the usual 15. And they'll make sure that you get that vaccine in a facility that can support you if you have that kind of reaction. That's it for reactions though. So right now, the ones that are available, no erythromycin. I'm not aware of any of the ones in study that have erythromycin in them, but I will tell you that you can get the exact list of ingredients of any Health Canada approved vaccine on the Health Canada website. Just do a little bit of Googling and you'll find it. That's exactly where I went for the list of ingredients. The next question, my husband and I are trying to have a baby. Are the vaccines safe for us to take while we are trying to conceive, and are they safe for me once we have? So kind of a twofold question there. When these vaccines get injected into our arm, it's the cells in this local area that are actually going to take the vaccine up and use it to produce those spike proteins that we talked about. They don't travel down to our reproductive cells. As well, I would say that the way that these vaccines work in theory would be safe for pregnant people, but they're not going to be doing research in pregnant people at this time. The Society of Obstetricians and Gynecologists of Canada is looking into this more clearly as to whether or not we're going to end up giving this vaccine to pregnant people, and I don't really feel qualified to give you the best advice for that one. I'd say that while you're trying to conceive, but currently not pregnant, it would be safe for you and your husband to receive the vaccination. But you would really want to talk to your obstetrician or family physician on a one-to-one basis to figure out whether or not the risk for you is outweighed by the benefit of the vaccine once you do become pregnant. Right now, we are not giving it to pregnant people in Canada. If it changes, I'll let you know. The next one, they would like to know whether or not the vaccine affects our DNA. The answer to that is no. Our DNA lives inside of the nucleus, or the center core of all of our cells. When we inject the vaccine into our arm, the mRNA will travel into the cell, but it never actually enters the nucleus. The instructions are given to our protein-producing cells that live outside of our own DNA. So it does not in any way affect the building blocks of our own bodies. Next one. When and how will long-term care facility residents receive their vaccinations? So you may be wondering, why are we not using the Pfizer vaccine for our most vulnerable populations, which are those that are living in nursing homes? That's where most of our outbreaks and deaths have occurred. And that's because of an unusual feature of the Pfizer vaccine. It requires really cold temperatures for storage and isn't recommended to be transported very much. As a result, we can't bring it to small towns like Hanna and know that it's going to be effective right now. So we have some vaccine in Drumheller, and we decided to send, or not we really, but Alberta Health Services decided to put the sort of highest risk healthcare workers on the first list because they can travel to the individual centers to receive that vaccine. So ICU physicians and nurses, emergency room physicians and nurses, and long-term care physicians and nurses and care aides are going to be getting the vaccine in the hopes that they can protect those vulnerable residents. There is a second vaccine that's available from a company called Moderna, same type of mRNA vaccine, but a little bit different. This one has the ability to be transported and stored at lower temperatures, more normal temperatures. And so that vaccine in Alberta is being reserved for the long-term care residents. When it gets here and gets approved by Health Canada, which should be happening within the next month, that vaccine will go directly to our long-term care residents. So provided there isn't any blips in the process, I fully expect that our long-term care residents will start getting it in January. Until then, the Pfizer vaccine will be given to the people who care for our loved ones in the long-term care facilities. The last question that I received was, if masks are mandatory indoors, why are dentist offices exempt? It's kind of a funny question because they're not. There is no individual workplace that is exempt from indoor masking. There are some special rules around farms and ranches, and I haven't really looked into those in details because I definitely am not a farmer or rancher. But all indoor office spaces, such as dentist office and doctor's offices, are not exempt from masks. What you may notice is that if you go to a dentist, of course, you can't be wearing a mask while they're working on your teeth. So you would not be masked, but your dentist and all the people who provide care for your teeth should be masked. It's similar to in the doctor's office. You're going to wear a mask in to come and see me, but if you've got a sore throat, I need to look in your throat in order to be a good clinician. So I'm going to ask you to remove your mask while I do that. I will still be wearing both my eye protection, my goggles or my face shield, and a mask when I'm examining you. That's all the questions that I have right now. So I just kind of thought I'd finish with letting you know that, people said, are you going to get the vaccine, Dr. Fortna? And my answer is absolutely yes. I have been witness of the bad things that COVID can do. I've had colleagues who have seen even worse things that COVID can do. So my overall opinion is that the risks of the vaccination are really, really small. I'm going to get a sore arm. I might get a fever for a couple of days, and I might be really tired. I'm still having toddlers at home, so I'm definitely not going to get much extra sleep with that. But the risk to me and my loved ones of an infection, whether it be common cold symptoms for me, what about blood clots long term, that long COVID you've heard about with lung issues moving forward, being intubated and the complications of that, those are really bad. So for me, the benefit of the vaccine far outweighs the risk, and I'm really excited about the time that I get my vaccine. So please continue to send me any questions that you may have. I will do my best to answer them. But for now, I want to wish everyone in our area and our viewers from abroad a very Merry Christmas and a Happy New Year. I look forward to chatting with you in 2021.